Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in the profession. Today we'll be seeing about nursing informatics. So nowadays the computers is being inculcated in every professions, because in ancient times and all, in our nursing profession we used to pile up so much of documents, so much of paperworks. We have to do the documentation, recording and everything in a written form, and it was a very cumbersome process, and also it was a very time consuming. To each and every time we have to see what all records we have maintained, what are the things is being carried out for the patient, and what is the continuity of the care. It was a bit difficult for every healthcare professionals to just go and verify it each and every time. But later on, due to various advancement in the technologies and the trends, the computer has given a new face into the medical profession. So in computers we can feed all the informations related to patients and everything. So it has become as a one of the very important aspect in healthcare. So we'll see one by one in detail. So nursing informatics is an emerging field of study, is a field of integrating informations and computer science with nursing to enable the nurses to collect and manage data into information and knowledge, and make the knowledge based decision about the patient. That means we are going to collect the each and every information from the patient, and we are going to feed it into an electronic device that is known as computers. This computer helps us, the nurses, to collect and manage the data and then process the data into informations and knowledge. So it also acts as a evidence based nursing care. So each and every time we need not go and just see the documents what we have maintained, that is the paperwork, whereas in computer we can see each and every information regarding the patient, and it is very quick to access. The example is the computerized to provide order entry. For example, the doctor is telling us some order regarding the patients. We can feed it in the computer, and whenever it is in need, we can go through it. Next is electronic medical records. Regarding the patients, we maintain the electronic medical record. Progress note, that is a documentation. Nurses' documentations is being maintained in the computers. Next is nursing notes and medical records. So nursing notes, like we in healthcare professionals, we maintain a nurse's record. So what are the vital signs we have checked, what is the plan of action for today's care, and what is the basic need we have fulfilled, and what are the procedures we have done, like that everything we used to do in the recording and reporting. So like the patient have a stable vital signs, everything. So that is now it is being fed into the computer. That is a nursing notes. And medical records, like they have underwent any diagnostic evaluations like blood investigations or any X-rays, CT or MRIs. So everything will be fed up in the computer. So next we'll see the definition. The development and evaluation of applications, tools, process and structure which assist nurses with the management of data in taking care of patients or supporting the practice of nursing. So the nursing informatics, in simple term, it is a application of tools that process the structure which assist in the management process of the nurses. So we are going to collect all the informations from the patients, then we are going to feed up into the computers for the quick access of the informations and records. Next, the framework of nursing informatics is, first one is data, second is information, and the third one is knowledge. So we'll see one by one about this framework. So data, it is defined as discrete entities that are described objectively without interpretation. So whatever I am just getting a raw information from the patient now, that is known as data. So information as a data that is interpreted, organized or structured. For example, patient is telling like I am having an increased temperature or fever, that is known as data. Then what I will do is I will do the diagnostic evaluation and identify what type of fever is, that is known as information. Next is knowledge, as information that has been synthesized so that interrelationships are identified and formalized. So after that what happens, the data is being collected, then it is being interpreted what that fever is, then we will tell like if that is going to be dengue fever, then we will assess for the platelet counts. So in that way the informations are being carried out continuously. So in management and process, first is data is collected, information, that is interpretation of the data is being done, that is known as information, then it is known as knowledge. So exactly what is the rationale behind the data will identify. Next is basic concept of nursing informatics. So nursing science, we have computer science, cognitive science and information science. So we will see one by one in detail about each and everything. So a nursing science means a well versed with nursing profession with clinical proficiency. So in nursing professions we have to be very proficient, and we must have both theoretical and clinical knowledge. Next is computer science. Here the nursing informatics, the nurse must be aware and understand the basic of computer, that is hardware, software, ergonomics and computer programming languages. That means what is control means, what is tab, what is F5, what is enter, where is space bar is there. Like that, a basic information regarding the computer has to be studied by the nurses so that she or he can perform very well in the nursing, like in computer. So like feeding the informations or doing the intending, like that we must know what is the basic language of the computer. Next is information science. So here the nurse must know how to complete the information, data mining, which involves finding pattern in data, information aggregation and everything. So for example, I am going to just feed any information regarding the patient, like previously in 1 week before the patient had underwent this surgery, this all the complications has occurred, so or this all the treatment modalities has taken place, like that I am going to feed in the computer. So that for that purpose the nurse must have a basic information regarding the computer. Next is cognitive science. That means the memory of the computer. Next is importance of nursing informatics. That is, it is going to improve the access to patient information. That is, if for example the doctor is coming for the rounds, suddenly he is asking what is the HB level of the patient and what is the bleeding time of the patient, like that if he is asking means immediately we can go and refer the system and tell. Next is timely data, like collecting, storing, processing, etc. Manage delivery of nursing care, link the research resources, apply educational resources. So we can timely collect the data and we can store it and process it, and whenever it is required we can just tell to the doctors or other healthcare professionals. So other importance is like integration of data, informations and knowledge. Next is promote the generation, management and processing relevant data, effective decision making. So once we are just storing this information in the computers, it will be very effective in making the decisions, because there will be a continuity of the care will be there for the patient. That's why. Next, allow for the evaluation of nursing. So if there is a continuity of care means we will know that where we have stopped and what was the value of last investigation and what is the next plan, like that we can do it properly, and that is known as continuity of the care. So and in the same way we can integrate data, information and knowledge. So data is something which is being given in the raw, next it is being interpreted or analyzed, that is information, then it is being in the memory is known as information. Next is benefits of informatics in general. So it increases the overall efficiency. So like due to the advancement of technology, if the healthcare professionals are using the computers means they as a nurses we get updated to the new technologies. Next is it aids in analyzing the large data in a short time. So many very complicated informations on and also very length informations can be scrutinized, and it can also be just stored in a very simple manner, and whenever required we can just use it. Next, allows the nurses to devote more time for clinical activities or patient care. So this is one of the very good the computer has come into the nursing profession. Why? Because we as nurses we work very hard on the patients, we do a patient care, but we have very less time for the documentation. But since and also in various situations the nurses do all the works, all the benefit to the patient, but due to the improper documentation they face the legal and ethical issues. So in order to prevent these all things, this computer is very much helpful for the nurses to update the data now and then and every time. Next is benefits related to electronic medical record. That means as once the patient is coming into the wards like IP or OP, whatever it is, like outpatient or inpatient, we are going to feed their information into the computer. So what all diagnostic evaluations underwent we can know, and where the patient is being admitted, what is the last investigation the patient underwent, like diagnosis, like blood investigation or x-ray, like that we can come to know each and everything about the patients. That is electronic medical record. Next is related to use of decision support software. So provide a historical and current data reports for effective data management, and also if there is any discrepancies, we will come to know that this all delay is being there in the patient side, like that. Next is point of care computers placed on the nursing unit provide access to patient electronic records to nurses and other healthcare providers, resulting in error-free order, identifying drug and food allergies, documentations of medications. So like if a patient is having so much of medications, means it is very easy for us to feed those medications into the computers, and error can be prevented, because every human makes mistake, but only fools repeat. We have that famous proverb, no? In the same way, everyone makes mistake, but sometimes it can be rectified by using these computers. Next is World Wide Web is used by nurses for informing themselves of current research, experiences and publications in healthcare and nursing. Worldwide we can connect with other healthcare professionals, like collaborative care can be given, and mainly in the COVID era and all, we have come across telemedicine, telenursing, like from one end of the village to other cities, we can connect to the patients, everything. Consumers are informed about aspects of wellness and quality of care, element of healthcare. So even we just give the informations regarding the wellness and illness and how the qualities can be improved, the health education can be given, and also elements of healthcare can be promoted to the patients, and everything can be done. Next is functions of nursing informatics is access the health information. So it is very easy for the nurses to access or open all the documents related to patient. Next is develop, implement and evaluate method of patient care. So what patient care we are going to give. So we have various patient assignments, right? So we can able to just identify which patient care we are going to evaluate. Next we are going to see about the informatics competencies required for nurses. So first one is computer skills. Next is informatics knowledge. So we as a nurses should have a computer skill regarding the what are the basic languages we must know, what is about the control tab, what is meant by F5 tab, what is meant by enter, how we have to type it, everything we know. So we use it for the administration purposes, communication purposes, like data access purposes, and also for the documentation. So administrations is like we have both eras, like beginners and experiences. So in experiences we use mainly for maintaining records, forecasting, and also the communications. That is if you want to communicate, means we can just send the mails and web, everything. Next, data access, like we are going to just use those data access in the computer regarding the patient care, and what all the nursing care we have underwent, we can do the documentation, like I have checked the vital signs, I have the doctors has ordered for the change of medications, the doctors ordered for the emicit drug or ranitidine drug, or any kind of investigation the doctor has planned, like that each and everything can be used as the computer. So also we used for the education purposes and research purposes and everything. Next is the competencies, mainly that involves 5 major component standards, that is problem identification. We'll come to know what is the exact problem. So even in our nursing profession, we do the nursing diagnosis, no? So first we'll assess what is the need. So it is very easy for us to assess their needs. Next, alternative identification. Is there any alternative available for the patient? For example, if a patient as having breathing difficulty or respiratory infections, if we are giving any nebulization, so if the patient is just having worry on nebulization, means we can say, okay, what is the alternative for nebulization, what we can do. So we can ask the patient to do the steam inhalation, everything like that. Next is trends in informatics is electronic health records. So electronic health record means it is a version of patient's medical history. We maintain the record in booklet form. There will be various forms. Informed consent will be there, surgery consent will be there, patient's hospitalization consent will be there, everything will be there, doctor's records will be there, nurses records will be there. But now when the computer has entered into the nursing profession or medical professions, we will feed everything into the computer. Next is remote healthcare devices. So now and all, in previously and all, the physical touch, therapeutic touch, it was very much important. But nowadays what happens, due to the improper technological advancement in certain areas like remote areas, but since there also we are providing the health services like telemedicine or telenursing. So without the mere touch of the patient, we are going to touch them virtually, and we are going to tell them like you have to take this and all medications. These all foods can be taken like that. Next is mobile app technology. So mobile app technologies, it is like a we are using those technologies to improve their informations, and what all doubts if they have, they can utilize the mobile app, and they can access to the information that is being fed up by the hospitals or any institution. So it is a tool that is for the applications of mobile devices. So each and every, because nowadays everyone is having mobiles, no, it will be easy for them to access this mobile app technology. Next is trends in nursing informatics. So past time and all, it is defined as a use of computer technology to support the nursing, including clinical practice, administration, education and research. First generation, it was designed to speed paperwork and communication in general. So now, from the past, it is now being changed. So before and all, when it came into existence, in the computer, when it came into existence, it replaced the paperwork. But now how it has been given the advanced shape, like we are using the computers for the research purposes and for maintaining the evidence based nursing care, and we do perform a collaborative care, so we can just have access the information to other healthcare professionals, and in future we can go for the research purposes, and also improving the quality and continuity of the care can be done, and potential areas of cost containment can be prevented, and also it act as a opportunity for all the healthcare professionals to connect with each and everyone from one pole of the earth to other. So in future it will be very useful in every aspect of the nursing profession. So that's all about the nursing informatics. So we have seen about what is nursing informatics, and what are the aspects of nursing informatics, and what is data, informations and knowledge, and what are the functions of nursing informatics, and what are the benefits of nursing informatics. So like mainly we are focusing on the computers in healthcare professionals in order to have a quick access and have a continuity of care, and reduce the paperwork of the nurses, and also improve the advanced technologies. They can give more nursing care, and the documentation, that is paper documentation, can be prevented, and it is very easy for the nurses to have a continuity of the. That's all about the nursing informatics. If you have any doubt, kindly drop down in the comment box. Kindly like it, share it and subscribe it. Thank you for watching.